Drug abuse not only costs lives, it costs Indiana taxpayers plenty. Medicaid fraud runs in the millions of dollars. RTV6 reporter Jack Reinhart joins us live from our Monument Circle studio with that side of the story. Jack?
Well, Erica, the state of Indiana ranks in the top 10 according to the Center for Disease Control in the number of prescriptions written by Hoosier physicians. And that, investigators say, can be a prescription for fraud. They are the most potent drugs on the market, the opioids that have the power to heal and the power to kill. And increasingly, Indiana taxpayers have unwittingly foot the bill for an addict's drug habit.
For $7 a milligram, some of these pills are being sold. So not only is it great for if you get 90 hydrocodone and you take 45 yourself to get high and you sell 45, it's a never-ending habit. Sell to supply yourself.
The Attorney General's Medicaid fraud unit is vigorously pursuing dozens of cases against physicians and health care providers who have gamed the system at taxpayer expense. Investigators say some doctors have prescribed inappropriately highly addictive drugs. Indiana taxpayers not only pay for the office visit, but the prescription pain medications as well.
It is not unusual for the Medicaid program to pay an overprescribing physician $1 million over a 4-year time period. And likewise, I have seen some of our more egregious cases. The Medicaid program will pay around the same amount, sometimes as much as $2 million for the prescriptions alone.
Over the past 18 months, no fewer than 15 medical professionals across the state have been accused of operating pill mills, much of it at taxpayer expense. The Attorney General's office estimates that Medicaid prescription fraud alone costs Hoosier taxpayers upwards of $30 million a year.
So by the time they get someone who is a Medicaid patient on these highly addictive painkillers, they have a patient that they can continue to sell, probably sometimes fatal doses. So it's really a big problem here in Indiana.
Now the Attorney General will ask the legislature to increase his budget by $1 million, that to increase his staff to investigate the expected increase in fraud that will come with the Obamacare when it comes to Indiana. Reporting live downtown, Jack Reinhart, RTV6.
Let's give you some numbers now to give you an idea of just how bad prescription drug abuse is in Indiana. More than 1,000 Hoosiers died from prescription drug overdoses in 2012. That's compared to fewer than 500 in 2003. According to the Centers for Disease Control, Indiana ranks 17th in the U.S. in the prescription drug overdose mortality rate.